Hi everybody, I am Dr. K. Prasanna Kumar, a general and laparoscopic surgeon from Department of General Surgery, having of more than 5 years of teaching experience and more than 6 publications to my credit and 5 professional bodies. And today we are going to discuss about the topic ulcer, cyst and tumors. What are the objectives is to learn from this topic is basically definitions and clinical examination, how do you treat the according to this. So we'll go into the topic ulcer. Ulcer, first definition, introduction of ulcer. An ulcer is a break in the continuity of the covering epithelium, skin or a mucous membrane, which commonly extends into the underlying connective tissues. Results from necrosis and subsequent sloughing of the tissue. Commonly, it is caused by trauma, any kind of infections, any vascular insufficiency and malignancies. And classification of ulcers, we have few types like traumatic ulcer, infective ulcer, venous ulcer, arterial ulcer, and neuropathic and malignant ulcers. And traumatic ulcer, which is caused by mechanical, chemical or thermal injuries. So commonly injuries occurs to the oral cavity, limbs that can be upper limb or lower limb, and the pressure areas like over the gluteal regions and over the back regions. And it is a painful with the irregular margins and slough will be present. So it heals with the removal of a cause and with a proper antiseptic care, that is wound dressings. Infective ulcers, it can be results from any kind of infections like bacterial, fungal and viral infections. For examples, tuberculosis, syphilitic and tropic ulcers. Edges often undetermined with granulation tissue base, which requires antibiotics and specific antimicrobial therapies. Tuberculous ulcer, which is mostly commonly caused by mycobacterial tuberculosis in our India, and edges are undermined, base pale with unhealthy granulation tissue will be there. So often it is secondary to any kind of lymph node involvement infections. So treatment should be anti-tubercular treatment. Simultaneously we have to treat the wound dressings and we have to heal the wound. So syphilitic ulcer is another cause and another type of an ulcer which can be differentiated into which can be divided into primary, secondary and tertiary. Primary, it is nothing but hard chancre with indurated base, and secondary is mucous patch which is painless, and tertiary is gummatous ulcer with punched out edges, and it is these syphilitic ulcers are treated with a penicillin regimen. Tropical ulcer, common in tropical climates due to mixed infections, begins as a papilla and ulcers with undermined edges. So painful, foul smelling discharges with the futures will be there, and which this tropical ulcer requires a proper wound debridements and antibiotic coverage. Next we will talk about venous ulcer, which is more important, which is because due to a chronic venous insufficiency and located around the medial malleolus, and which is usually the ulcer will be a shallow shaped, shallow irregular edges with pigmented around, that is hyperpigmentation. So that is hyperpigmentation is due to the stasis of the fluid, and this venous ulcers has to be managed with the limb elevation and compressor dressings, and if it is needed we have to treat the primary cause, that is it can be a varicose veins. And this is arterial ulcer, it is commonly due to any ischemic changes in the vessels. Okay, usually it is a painful and punched out with a pale base, common over the toes, heels and lateral malleolus, and which requires a vascular corrections and a wound care to treat the accordingly. So neuropathic ulcers, which has been caused by any sensory loss. For example, due to most common cause is diabetic neuropathy. Okay, so usually it will be painless, located on the pressure points, surrounding skin will be thickened and with the callus formation will be there. So control the infection and offloading procedures can be helpful to treat these conditions. And next we'll talk about the pressure ulcers, which is results from the prolonged pressures and ischemia seen in bedridden patients and paraplegic patients. We have the gradings of these bed sores or pressure ulcers like grade 1 to grade 4. So grade 1 is nothing but erythema stage will be there, and grade 4 is nothing but deep necrosis will be there. So this can be prevented only by repositioning and frequent mobilization of the patient and with a proper wound care. Even we can tell the patients to mobilize frequently, and we can tell them to use the alpha bed or a water bed for the to prevent this kind of pressure sore ulcers. So next we will talk about malignant ulcers, which commonly develops from the chronic ulcers, that is marginal ulcers, and edges will be averted, indurated with a foul discharge will be there, and biopsy is necessary for the confirming the diagnosis. So treatment is we have to do a wide local excision according to the size and shape and the site of the place ulcer. And commonly in general, the clinical features of any ulcers, we have to look for the pain, any kind of discharge, any kind of bleeding, any slough is present or not. And margins and base characteristics, margins and the base characterize the diagnosis. So surrounding skin changes should be included and has to be ruled out, and has to be examined properly. And systemic examination, or like for example, we have to find out any kind of primary cause for this ulcers. It can be venous, it can be malignancy, it can be arterial ulcer, or it can be diabetic, or any other causes we have to find out, and we have to treat according to the systemic cause also. So what are the investigations we will be doing for the ulcer? So first investigation, which is very important for any kind of ulcer, is swab wound culture and sensitivity. Okay, and that is more important. If any kind of pus discharge is present from the wound, we have to send for the pus wound culture. And if any kind of slough is present, we have to send the tissue culture for diagnosis. So similarly, the biopsy, if we are suspecting any kind of malignancy, we have to take a edge wedge biopsy. Will be helpful to the rule out any kind of malignancies. And other investigations like Doppler scan and angiography for vascular ulcers or venous ulcer will be helpful. Similarly, simultaneously, we have to look for any blood sugar levels, and any serology or infective causes we have to look out. And we have to always, importantly, we have to look here is the total blood count, which is very helpful to any kind of infection is there or not, or any kind of sepsis is there or not for the patient. So in general principles of management of ulcer, we have to first identify and treat the underlying cause, and wound debridement and infection control, and optimizing the nutrition and circulation is important, and dressing and appropriate antibiotics will be helpful for the treatment of ulcers. So these are the basic outline of the treatment of the management. It completely depends upon each type of the ulcer, we have to treat accordingly. So we have specific treatment approaches also. I will tell you in a brief manner. Venous ulcers, compression dressings will be helpful. We have similarly compression dressings is nothing but we have a total 4 gradings all there. So commonly we use for like grade 2 to grade 3 to venous ulcers. So if it is a lymphatic lymphedema patients, then only we have to use for more than grade 3 compression dressings. Commonly we will be using grade 2 compression dressings for the venous ulcer. For arterial ulcer, we have to make sure the revascularization is there. So we have to confirm this by doing a proper Doppler scan, and we have to look for any kind of blockages there. So we have to confirm with angiography if needed. So neuropathetic ulcers, offloading procedures and diabetic control is more important, and infective ulcers, specific antimicrobial therapies will be helpful. So now so far we have been discussed about the what is ulcer and its types and its management. So now we'll be talking about the complications of ulcer, which is also very important. If we are not treated in time, so what are the possibilities can be there? So it can lead to secondary infections, and it can lead to cellulitis also. And patient may cause hemorrhage can be there, and sepsis also can be lead to this condition. And any scarring and contraction of the tissue will be there. And sometimes a malignant transformation in the chronic ulcer is a possibility thing. So healing of an ulcer is very important, so which commonly occurs by any granulation and epithelialization. So it depends upon the vascularity of the wound site and infection control over the wound site, and proper wound care which helps in better wound healing. So chronic ulcers may require skin grafting or a flap coverage over the wound. So summary of an ulcer. So ulcers are a tissue loss lesions with any kind of etiologies. So diagnosis should be based on the location, margin, and type of an ulcer and type of a discharge. So management has to be focused on cause of the correction, and a wound care is more important. So early intervention of an ulcer will prevent the chronicity and malignancies. So key take home for this topic of an ulcer is nothing but a tissue loss below the epithelium access the cause and circulation always, investigation to rule out any infection and malignancy. Holistic management ensures the best healing. So now we'll go with the topic cysts. So definition of a cyst. A cyst is a pathological cavity having a fluid or a semi-fluid content. So usually it is lined by epithelium. May arises from developmental obstruction or degenerative processes. So can occur in any tissue or organ. So classification of a cyst, it can be a congenital cyst, retentional cyst, implantational cyst, parasitic cyst, neoplastic cyst and pseudocyst. We'll talk in briefly each one. So we'll talk about congenital cyst now. So presents with from the birth due to developmental abnormalities. For example, brachial cyst, thyroglossal cyst and any kind of dermoid cyst. So which are there lined by the epithelium and which is derived from the embryonic remnants. So often contains a clear or a cheesy fluid content. Okay. So now we'll talk about retentional cyst which is caused by obstruction of a duct of a gland. Okay. Retention cyst which is caused by a obstruction of a duct of a gland. For example, mucus cyst, sebaceous cyst, which are contents or secretions retained from behind the obstruction. So treatment is for excision and biopsy is a requirement for retention cyst. So now we'll talk about implantation cyst. It is due to implantation of epithelial cells into deeper tissues and after trauma. So commonly occurs after penetrating injuries. Which is lined by squamous epithelium and filled with keratin. So treatment is a complete excision and biopsy is needed for this kind of implanted cyst. So parasitic cyst, it is caused by any kind of infection. It is parasitic infections. For example, hydrid cyst, which is commonly present in the liver. Okay, which is lined by the parasitic derived membranes, which contains a clear fluid and a scoliosis. So which requires a surgical management for these conditions. So neoplastic cyst, which is a part of a benign or a malignant tumors, cystic adenoma or cystic adenocarcinoma are the examples for this condition. So which commonly the fluid contents will be serous fluid or a mucinous fluid, which has to be managed as per the tumor type of the tumor. And pseudocyst is nothing but a cyst will resemble like a original cyst, but it is not an original cyst. So that is nothing but how we can to differentiate a normal cyst and a pseudocyst is nothing but usually the cyst will have the covering epithelium lining will be there, but in pseudocyst there will be lack of epithelial lining which is formed due to liquefaction of necrosis or a trauma. So for example, pancreatic pseudocyst, so which has to be managed surgical management like drainage or any kind of other procedures can be done. So sebaceous cyst is nothing but it is also one type of retention cyst and commonly it will be present on the scalp, face or the back. So which contains a keratinous material and punctum is the identifiable feature which is present over the sebaceous cyst. So we have to treatment this has to be excision and biopsy. If you are not treated the sebaceous cyst in proper way in time, it may get infected, especially in diabetic patients. It may get infected and we have to do only incision and drainage. So we have to treat the we have to identify the sebaceous cyst in time and treat accordingly. And now we'll talk about dermoid cyst. Developmental cyst lined by squamous epithelium which contains a hair, sebum and epithelial debris which commonly in midline and sites of the embryonic fusions. So treatment will be the surgical option. So that is surgical excision. So now we'll talk about one important topic, that is thyroglossal cyst, which is commonly arising from the persistence of thyroglossal duct. So it is commonly present in the midline, neck swelling will be there, which will move with the tongue protrusion. Please remember, any neck swellings we will be examining like protrusion of tongue and swelling, whether the swelling is moves with the protrusion of tongue or swelling moves with the degglutination. So only in thyroglossal cyst the swelling will move with the protrusion of the tongue. If in case if it is the swelling is only confined to the thyroid, it doesn't move with the protrusion of tongue. It only moves along with the degglutination. So in thyroglossal cyst, if you are not treated in time, there is a high risk of infection and fistula formation can be there. And the treatment is surgical excision, that is called cyst trunk operation has to be done. Now brachial cyst, which is a remnant of a second brachial cleft located along the anterior border of sternocleidomastoid muscle, which contains a clear fluid may become infected, and if it has to be treated surgically, that is complete surgical excision. Now, hyoid cyst, which is caused by Echinococcus granulosus, hyoid cyst, which is caused by Echinococcus infection, which is commonly in the liver, and it can be possible to form in the lungs also, which contains a clear hyoid fluid, and daughter cyst can also be there. Here the management will be like a procedure name called a PAIR, P-A-I-R. That is percutaneous aspiration injection. And now we'll talk about pancreatic pseudocyst, which occurs after pancreatitis due to a pancreatic pseudocyst is nothing but occurs after pancreatitis due to ductal leakage, which contains enzyme-rich fluid and may compress surrounding the structures, and treatment is internal and external drainage. Investigation of the cyst, that is any kind of cyst, in basic investigations is like mostly it is a clinical examination, but to confirm what is the type of the fluid and the extent of the swelling, we have to do by the ultrasound scan. If needed, CT of the localized area can be also helpful, and FNAC or aspiration for the diagnosis, it will be also helpful, and serology for any kind of parasitic cyst, and histopathological examination after we done the procedures, that is we have to send for the any kind of swelling. If it is possible, we have to send for the biopsy. So if you are not treated the cyst, what happens to the patient? So complications of cyst. So like in any kind infections and abscess formation will be the first important thing, complications, and rupture and spread of the content, and pressure on the adjacent structures, and sometimes very rare but malignant changes can be also occurs over the cyst if you are not treated in time. So general principles of management of any kind of cyst is accurate diagnosis and before intervention, avoid incomplete excision to prevent recurrence. So we have to make sure whenever we are planning for a surgery, we have to make sure we have excised the swelling in toto. That means we have to remove the swelling incompletely, so to prevent the recurrence. And aseptic techniques and for the parasitic cyst, and histopathological examination for the confirmation of diagnosis. So surgical management is nothing but total excision is a cure for most of the cyst, and which avoids a ruptures before surgery. So and drainage only if it is infected, that is incision and drainage procedure can be done if it is cyst is infected, or any kind of we are suspecting a pseudocyst. So recurrence prevented by complete removal of the wall. So this is a summary. I am going to now I am going to discuss about the summary of the cyst. Cysts are a cavity with a fluid or a semi-fluid content, may be developmental or obstructional or a neoplastic. These are the causes. So diagnosis by the imaging and histopathology, and treatment is surgical excision in the most of the cases. Key takeovers, home take message is for the cyst is nothing but cyst is nothing but an epithelial lined cavity with a fluid content, which has to be recognized, and type of cyst has to be identified and treat accordingly. So avoid rupturing during the surgery. Avoid the rupturing of the wall of the cyst during the surgery. So histopathological examination is a mandatory to confirm your diagnosis. So now we'll discuss about the topic tumors. A definition of a tumor is a growth of a new cell which proliferates independently of a need of the body. Okay. A definition of a tumor is a growth of a new cell which proliferates independently of the need of the body, and it can be a malignant or it can be a benign condition. It commonly caused by any kind of genetic mutations which leads to uncontrolled proliferations. So forms the basics of oncological studies. So how we have to classify the tumors? It can be benign tumors, it can be malignant tumors, and it can be a pre-malignant conditions also. So based on the tissue of an origin and biological behaviors. Features of a benign tumors. How can we say the swelling is a benign tumors? So any kind of slow growing and encapsulated which does not invade or metastasis. Cells resembles like a normal tissue that is well differentiated, and usually it is caused by symptoms by pressure effects only. And the features of malignant tumors, which has a rapid infiltrative and encapsulated growth, which invades the surrounding tissues, and metastasis will be there. So cells shows a pseudomorphism and atopia, which often recurs after removal. So high recurrence chances will be there in malignant conditions. So any tumors mode of spread can be a local invasion, lymphatic spread, hematological spread, and transcoelomic spread, and any implantational spread. So first, local invagination is a tumor cells which infiltrates the surrounding tissues, which destroys a normal architecture, seen in both malignant and locally aggressive benign lesions. So important for a surgical marginal determination. Lymphatic spread is nothing but commonly it is in malignancies will be there. So any lymphatic spread, we have to lymphatic spread which is common in carcinomas and follows the natural lymphatic drainage pattern. So regional lymph node enlargement and hardens helps in tumor staging. Hematogenous spread, which is a typically of a sarcomas. It can be via any veins, lungs, liver and the bones. So micrometastases often precede radiological detections, which requires systematic therapy. Transcoelomic spread spreads across the body cavities, common in ovarian and gastric cancers, result in peritoneal seedling and ascitic formations, and managed by cytoreduction surgeries and a chemotherapy. So implantation spread is nothing but heterogenic spread which occurs accidentally during a surgical manipulations. So prevention is by proper oncological surgical techniques. So seen in gallbladder or ovarian malignancies, spillages. So in general, clinical features of any tumors will be like, first, tumor is nothing but a swelling. Okay, so first clinical features will be a swelling, pain, ulceration or bleeding can also be there. So loss of function or a compression effects will be there. Systemic effect symptoms like weight loss, loss of appetite and anemia can be also be important features. Metastatic features will depend upon the site of the metastatic spread. So investigations commonly we do for the tumors is nothing but histopathological examination, which is a gold standard technique, and imaging like ultrasound, CT, MRI, PET scan. For all these things will be helpful for the staging and to know the and treat the accordingly. So tumor markers for specific cancers also is there. We have to identify and we have to do it accordingly. So biopsies confirms the diagnosis. Now, benign versus a malignant, that is comparison between what is benign and what is malignant. So usually benign will be a slow growing, localized and well differentiated. In malignant it will be rapid in spread, invasion will be there and metastatic lesions will be there. So recurrence is rare in benign but common in malignancy. Benign is a curable by only by excision, but malignant needs multimodular treatment is like by surgical treatment, it can be a chemotherapy, radiotherapy has to be needed. Now tumor grading and staging. Grading is based on the differentiation and myotic tumor grading and staging. Grading is based on the differentiation and myotic rate. Staging is extent of the spread we should know. That is, we commonly use the TNM staging. So both essential for prognosis and the treatment planning. So higher grade and stage, the poorer prognosis. So treatment modalities, what and all we have, as we discussed before, surgical management, that is mainstay for a localized tumors, radiotherapy for local control, chemotherapy for systemic diseases, and immunotherapy and target therapy in advanced cases. And prevention and screening, how to prevent this any kind of tumors. To avoid carcinogenic exposure, we have to take a proper vaccination like HPV and HBV vaccination if needed, and screening for regular, for screening of a breast, cervix, colon cancers, and early detection will improve the survival rate. And complications of malignant tumors, which is metastasis and organ failure and anemia, any kind of infections and hemorrhage and treatment related toxicity can also be there. So prognosis, which is very important in case of tumor conditions, which is completely depends upon type of the tumor, staging of the tumor and response to the therapy. So early detection will helpful to treat accordingly. So regular follow-up is mandatory to know whether any patient is having any kind of recurrence or any kind of other conditions. So use of biomarkers as monitoring is also very important. So summarizing of the tumors are nothing but abnormal growth and autonomy. Benign are localized and malignant invade and spread. Diagnosis is by biopsy and staging investigations. Multimodular therapy essentials for cure. So take home message for tumors is nothing but always differentiate whether it's a tumor is a benign condition or a malignant condition, and histopathological examination is a diagnostic future, and comprehensive management which improves the patient survival. So early diagnosis will save the life. That's it for the today. See you soon. Thank you.